will start.
Okay, I will. So, these 3 hoses, one, 1, 2, and 3. You can take it away and throw it away when you're back in Thailand.
Yes.
Only for a year, so you have it easier. I just push it in.
There is a different size.
Yeah, they're different sized.
I see. Okay, they are two the same, but the one is different.
I think all 3 are the same. This one is the smallest, this one is a little bit taller, and is the tallest.
Okay.
You see?
Yeah, got it.
So just push it in. 1, 1, 1, 1, 1, 1, 1, 1, 1, 1, over here.
Number 1, connect to the box.
Correct?
Controller to the box, okay.
Correct.
Number 1.
Number two over here. That's the chamber O2 out one.
Yeah.
There's a little caption over there, just in case you want to know what it is. 2. Then this one goes into the distilled water.
Distilled
water is this little bottle here.
Yep.
Inside of here. And this one, the last number 3. This one
Yes.
goes in here. And chamber O2 in.
Okay. Chamber 2 in. Number 3.
And if you when you're putting it in and you witness that it's not a little bit too tough or too slow, then check it if it's the correct number.
Yep. Okay.
So all plugged in. That was plugged in as well. For now, I put a little bit of water inside. For the regular treatment, just use distilled water. For now, it's okay with ordinary water.
Okay. Distilled water. Okay.
So there's a little hose. I show you all the different parts of this machine. This little fella, you can drag out, and you can clean it as well. So in case it might fall apart or something, don't be afraid. Just put it back in.
Yes.
Tilt it a little bit for you.
Yeah.
This one. In this
just
little
the
hole, you see it?
A little hole. Okay.
In this little hole, just tightly. Don't push with all your force.
Okay.
Just so it's nice and firm. I'm gonna take the water bottle.
Yes.
Just a little bit too much water inside. Keep it filled halfway through.
Halfway through. Okay.
Halfway's okay. If you're having too much water inside, and let's say you have to move the chamber, and you're a little bit too fast, then the water might come out of the hose.
I see. Okay.
That's why. Just halfway. And once a week, change the water, please.
Once a week.
Once a week. So, not too tight, just it stays inside. So, this one is all right. Next one, we need the power cable. The same one like for the oxygen concentrator.
Yes.
But as well, you might just need another one for your...
Yes. For my country. Yes.
So, and again, we start putting it in the device first, then connecting it to the electricity. All right, this one is good. That's the operating window, but I will talk about this later. And now, like yesterday, we need the oxygen concentrator. Again, with 10 liters per minute.
Yes.
As a flow. Plug it in here at the back end. And then, again, let's do it like this. In here. Okay. When you're treating patients back in Thailand, make sure that no cable is on the way, so no one can stumble and fall.
Yeah.
Just have to keep that in mind, please.
Okay.
Now we connect these two machines with this white cable. First one, and again, this
Yes.
is exactly the same one like this, so there's no different which one you put in first. All the same.
Okay.
All the same. So pretty user friendly.
Yeah.
So, these are two parts. On a hose and this little end part. Just keep it ready and just start twisting the end thing. Tight, but not too tight. All right, there we go. If it's too loose, you might hear a little squishing sound. Then you know the oxygen is trying to escape and escaping. Here, exactly the same thing. Just press it firmly against it, not too hard, just firmly. And that's it. So, if you want, you can interrupt it real quick. We prepare you so you can start the treatment. Okay. All right? Yep. Or we let it run over there. Yep. Let's see if we have a pillow or something. Ah, this one. This one. Let's do it afterwards. And again, the user interface is English only for this. Okay. Yes. For your convenience. The sleeves. Where did we put them? There we are. We have mainly two different materials for the sleeves. One is latex, and this one is silicone. Silicone is more durable, but latex is more friendly to the skin because it's not so tight on. But some people have an allergic reaction to latex. That's why there are two materials mainly. Okay, that's the main reason.
Elastic. No, these are silicone.
This one is latex. Latex, and this one is silicone. Okay. I think we tried this one. Okay. It's size L. Mm-hmm. Then we can see if it fits.
Yes.
So, one second. All right. Before you lay down, we start over here by, come over to the table, please. By assembling these two parts. Sometimes it's quite a bit tricky because we have to put this ring.
Yes.
So this notch.
Oh, okay.
There's a little hole going around.
Yeah.
So we start over here. Needs practice, but it's worth it. And it's coming in. Now we're checking, is it all in? Is it all in? Is it all in? Is it all in? Yeah, we did a good job. Yeah, perfect. So, don't stumble. Next thing we're going to do, all right, please have a seat at first. Don't lay down.
Okay,
just
don't lay down.
I will drag this ring over your foot, and let's pretend there's a wound.
Okay.
So I have to stretch it just a little bit so the surface won't touch your wound. Normally you wear a pair of gloves, but for now I think we're good to go. Yep. So foot inside, keep it firmly away, over the feet. Okay, now please go over to the bed into a laying position. Foot inside, perfectly. Drag your trousers leg a little bit higher. Yeah, perfect, just like this. This ring, lift it up a little bit, please. Sure. Lift it up more to you. Keep it firm. Okay. Lift it up.
Yeah.
Press against it, so I can. Yeah.
Okay.
Perfect.
Okay.
Now you see, it's pretty tight around your leg.
Yes. Yeah, I can feel it.
Okay. Now I get the box a little bit closer to you. Have this ring fit on these two black parts. You see that? The ring needs to fit there, and when it's on top of it, you just press these three.
Okay.
Levers to the side, and it's resting.
Okay.
Next thing is your foot may not lay there like this because it may be a little bit awkward for an hour because you're touching the bottom. Yes. So you better have a pillow underneath.
Yes.
So the patient can rest.
I see.
The foot. Yes. And don't suffer any problems.
Okay.
Usually, let's take my check for the moment. I put a little bit of another pillow or blanket
I see.
This part of the leg.
Okay.
So it's all nice, and you don't touch the plastic ring on top of it.
I see.
It's quite important because an hour can be quite long if you have a permanent pressure on some certain point.
Yes. Okay.
So you only start when the patient is telling you he's doing fine. nothing is hurting, and then it's good to go.
I see.
Now I'm asking you, is it okay? Shall we start?
It's okay.
It's
Yeah,
okay.
It's okay.
So I'll have it turned to you just a little bit. You see, it's again connected with Velcro.
Yeah, Velcro.
You started. It's welcoming you with AOTIHyperBox.
Do we need to close this door?
At the end.
Oh, yeah, okay.
At the end. Because the concentrate is not running as well.
Not running yet.
He's welcome up with pressure, 50 millibar. It's already pre-set up, and the time 60 minutes. 60 minutes because the inflation time is much faster. So we have more cycles in less time.
I see. So 60 minutes is okay.
60 minutes
For the hyperbox.
Like yesterday, you can put in your food for 70 minutes, for 90 minutes, for 2 hours, but it's not significantly better. Only 60 minutes.
Okay.
That's the perfect result. When the display is showing you this message, you just go down one time, and he's asking you, start, question mark, press enter.
Yes.
And as soon as I press enter, he's going to inflate the inner system of the box, but unfortunately it's not working because the conservator is not running yet. So I put this together again, see if the Velcro fits perfectly. Now I close this, it's the working window, because once the patient's foot is inside, you still have room to operate. Here
Yes.
wouldn't be impossible, so here you
Yes.
can still fold it one
Yeah.
more. Have this window put on there, like this one, on these two black nuts. Press it firmly once, twice, and 3 times.
Yes.
And now it's okay inside. Now you have to make sure that the leg is resting easily. Next, the conservator is doing some noise, because I'm going to start it. 10 liters again. And now, let's press enter to start. And you can see, pressure is going up. Please lay down like you're an ordinary patient. 13, 16, 17, 18, 19, 20, 21, 22, 23. I'm going to show then the sleeve is going to hold the pressure. Twenty-six, 27, 29, 30, 31, 32, 33, 34. The first cycle is taking a bit longer, but then the other ones are going to. Just give me the camera for once, because I think oxygen is escaping somehow. Yeah, I have to make sure. Yeah, it's leaking.
Yes.
So now we have 35, 30, it won't go higher than 35. So we just stop it. Start all over again. If I put off this window too fast, you'll hear a plop, because there's a little bit too much pressure inside.
Yeah.
So just wait until there's no mini bar higher than the normal level. So this one, this one, this one. These are all. I just recheck everything again. All right. I just started again like usual, pressing the on-off button. It's asking me pressure time. Going down once, start, press enter. Pressure time. 5, 7, 8, 10, 11, 13, 14, 15, 16, 17. Just checking there. Where possibly might be. Might not. fit perfectly. So we check it next time.
Okay.
We open it. Okay. Thank you for the alarm. Just taking it out again. Putting it back there. Can you push in your leg a little bit further? Or let me do it like this. Stop. Stop.
Okay.
You lay there, and I push the box closer to you.
Okay.
Let's do it like this. I'll open the ordinary window again. Check if there's any problem. No, we should be fine. We should be fine this time.
Okay. Yeah, should be good.
Should be fine, should be fine, should be fine. And next attempt. I wait until you're ready.
Yeah.
I just
Okay.
say this one. Power off, press enter. I say yes, power off. So now the pressure should be decreasing inside of the box. I turn off the concentrator.
Yeah.
Well, you have to start the machine by pushing it once. Now it's welcome you with the pressure and the time.
And
Before we start it, turn over to the left. Start the concentrator, please.
yes.
By pressing here. Alright. Please step over here. I will have a seat.
Yes.
And hold the seal as tight as I can. 1 second, 1 second, 1 second.
Okay. I press down here.
Yo, let's try. Once down, and
Down
now it's
and
asking you.
into.
Perfect. Now the pressure should
Yeah,
be rising.
10, 11, 12, 14, 15, 16, 18, 19, 21, 25, 26, 27,
Let's see if our trick
30,
worked.
31, 32, 33.
Now it should be back to 0 because air escaped. Yeah, there was a little bit of a leak. Let's try it again.
Okay, start again.
Of course, it's easier when the leg is inside, but just for demo purpose.
Okay, 20, 23, 34, 37, 20, 31, 32, 33, 35, 36, 39, 40, 41, 41. Maybe some leak.
I think the seal is okay. Let's stop over it. Yeah, everything's okay. It just may not attack the surface. Otherwise, the air will escape and you won't have any pressure.
How about inside here? Also possible to
Both-
clean it.
both ways, both ways.
Both way.
And of course, this one because that's where the leg is going to rest
Yes.
during the
Yes.
therapy.
Yes.
Just wipe
Okay.
it all across.
Yes.
This one again, and of course
Inside, how to clean it? Yeah.
with the same solution, but I prefer if you can spray something inside. Nothing, no alcohol, because alcohol is going to attack the surface. Just the same one you used for cleaning the sleeves. You put inside of in the spray,
Yes.
put it in, let it einwirken, let it let it stay on the surface for a little moment, and then wipe it off again. Maybe 30 seconds, and that's okay. That's good to go.
Yeah.
But nothing aggressive. You have to keep that in mind. Nothing aggressive. Otherwise, it might really surface. It might damage the surface.
I see.
Even though it's quite thick, it's more than a centimeter. But if they have cracks, then the bacteria will come inside. The liquid or the oxygen will stay inside, but you will make a home for bacteria. You have to prevent that.
I see.
That's the only thing.
I see.
Perfect. High until you feel it's really tight.
Yes.
Just bend it a little bit. Bend it a little bit. Slowly inside, slowly inside. Okay, further, further, further. And now I'm coming a little bit closer with the box to you. Let's do it like this. Like this, like this. Put something under your leg again. So it's a little bit more convenient. Okay, let it rest. Try to lay a little bit more on your back and on your side. Perfect, perfect. Yeah. Just like this. be careful when your patient is sitting like that his knee won't hit
Okay.
the plastic.
Okay.
So just lift it a little bit. Should be all right. 1, 2, 3. We started. 1. Everything is sealed. Is everything sealed? Please describe to me what you're feeling right now. Like yesterday, or is it a little bit harder or softer or different?
I can feel harder
A
than
little harder,
yesterday.
okay. Because there's no space around your foot
Uh-huh.
than yesterday because of the bigger
Uh-huh.
inner volume. Do you feel air escape? I think I hear something. Let me just check on that. Let's do it like this one. Do you feel anything? No? This one is fine. This one is fine. Okay, 7:38, 39. Let me just pause it real quick for you. Let's have it run out. Yep. Push, push, and push. Foot is all right. This one is sealed. All right, we're rolling. So the perfect position would be like really laying on the bed, not having your head not on the wall, but having a comfortable cushion or a pillow underneath. Then you can support your leg with just another pillow, so it's on a good height. It does not touch the upper ring. The lower ring, of course, it touches, but if it's getting a little bit too hard, then you can put another towel or something again over there as well in order to protect your skin. The wound of the foot should be clearly and should be free inside of the box. Nothing should cover it. Like you've got a wound on the lower side of the foot, then make sure that no pillow is touching it.
Okay, not touching.